Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, and welcome to another episode of the Diverse Thinking, Different Learning podcast. For those of you who are new here, I am your host, Dr. Karen Wilson. Today, I am tackling a topic that many parents, educators, and even professionals often ask about: the difference between a neuropsychological assessment and a psychoeducational evaluation or a school-based assessment. And I have spoken about this topic on other podcasts, but I haven't spoken about it on this one. So that's what I am doing today. So when we talk about a neuropsychological assessment and a school-based evaluation, I think it's important to note that both play critical roles in understanding a child's needs, but they're not the same. And knowing the distinction is really important for families who are seeking the right support. So today, what I want to do is break this down for you. I'm going to draw on my experience as a clinical neuropsychologist and also highlight key information shared from the American Psychological Association's Division of Neuropsychology. And my hope is that at the end of this episode, you'll have clarity on what each type of evaluation entails, when and why you should pursue one, and how they complement each other. Now, before I jump into the difference between a school-based evaluation and a neuropsychological assessment, I thought I'd just talk about some of the reasons why people might seek an assessment in the first place, whether you are seeking that through the school district or through your school or privately. Typically, when someone is seeking an evaluation, it's because a child is struggling with reading, writing, math, or another academic area. They may be struggling more than their peers, or they may be struggling in a particular area relative to other areas where they're doing really well. So a child might be doing exceptionally well in math, but really struggling more than expected in reading. And parents want to have a better understanding as to why. Parents and teachers may also have concerns about behavioral issues, things like inattention, hyperactivity, or impulsivity that seem to be interfering in the school setting. And they might be wondering whether or not those behaviors are consistent with ADHD. That would warrant a diagnosis, for example. Someone else might be seeking an assessment to better understand underlying emotional or social difficulties a child might be having that may impact school performance or interactions with their peers. Maybe there's concern about anxiety playing a role or keeping them from doing their best in a school setting or even getting to school. There might be concerns about a child's developmental milestones. For example, they may have been delayed in language development or their motor skills early on, or maybe even their social development early on. And they're seeing that some of these difficulties, even though they've had treatment for those issues with OT or language therapy when they were younger, we're seeing some of those things impacting them in the academic setting now. For some families, they're seeking assessments to identify giftedness, and they want to make sure that their child receives appropriate educational support, opportunities. And so these are some of the reasons why individuals are seeking assessments for their children. One of the main reasons I see when parents come to me or to others in my practice is that a child is struggling and they don't know why. They're struggling with writing, with getting their ideas out on paper, and they don't know, is this a motor issue? Is this an expressive language issue? Is this dysgraphia? Is this executive functioning? Is this related to a reading disorder like dyslexia? They want answers because they want to make sure their child is getting the support that they need. So with that, now I'll kind of jump into the differences between a school-based assessment and a neuropsychological evaluation. I'm going to start with the school-based evaluation. So these evaluations are typically conducted by a school psychologist as part of the public education system committed to supporting students under federal laws like IDEA and Section 504 of the Rehabilitation Act. And the purpose of a school-based evaluation is to determine whether a child qualifies for special education services or accommodations at school. So these evaluations typically assess academic skills, reading, writing, and math. They may also involve an evaluation of cognitive abilities, problem solving, and reasoning. And they may also look at some behaviors and emotional functioning of a child, really looking at how a child interacts with their peers and adults in a school setting. And here's the important thing to know. School-based evaluations focus on educational impact. For example, if your child has a learning disability or learning disorder, the school evaluation will explore how it affects their ability to access the curriculum and succeed academically. So typically this evaluation involves standardized testing, teacher input, and observations in the classroom. And it results in a report that informs decisions about IEPs or 504 plans. So at the end of that process, you will have information about whether or not your child qualifies for accommodations or special education services, and you'll have information as to why. For example, your child has a specific learning disorder, or your child has an other health impairment, for example, in the area of attention that is impacting them in the classroom setting. What you won't get is a diagnosis. So even though, for example, a school-based assessment might say, your child has a specific learning disorder and that specific learning disorder is in the area of reading, you won't get a diagnosis of dyslexia. If you get other health impairment identification and it's related to attention, you will not get a diagnosis of ADHD because the school-based assessment will not make a diagnosis. And so you'll get some information that can be very helpful in determining the support that is needed in order for your child to succeed academically. The other thing that might happen is that some families feel like the school evaluation doesn't fully address their concerns. And they may be noticing some challenges outside the school environment. And those things may not be addressed in a school-based evaluation. And that's where a neuropsych assessment can provide some additional answers. And so when we talk about a neuropsychological assessment, that type of assessment is typically conducted by a clinical neuropsychologist like myself. And clinical neuropsychologists are trained to assess the relationship between brain functioning and behavior. And a neuropsychological assessment goes beyond the academic focus of school evaluations and is like what I call a detailed map of a child's brain functions. And what many neuropsychologists will say is that one of the main differences, for example, between a neuropsychological evaluation and a psychoeducational evaluation is really the lens that is used by the clinician. And the lens used in a neuropsychological evaluation is very brain-centered. It looks at how brain development and functioning might influence a child's learning abilities, challenges, behavior, and emotions. And so that assessment will examine things like cognitive abilities. We'll look at attention. We'll look at memory. We'll look at visual attention, auditory attention, visual memory, auditory memory. We'll look at problem solving, reasoning. We'll look at expressive and receptive language skills, processing speed, motor skills, executive functioning, things like planning and organization. We'll also look at emotional and behavioral functioning. We'll look at things like anxiety, depressed mood or depression, self-concept, self-esteem, self-regulation skills, all of the things that can impact daily functioning. In a neuropsychological assessment, we'll also look at social skills and adaptive functioning, which tells us how a child manages day-to-day tasks and relationships. As a neuropsychologist, I'm also going to look at neurological factors like sensory processing, again, motor coordination that can be impacted. We'll also look at the impact of any medical conditions, such as a history of seizures, traumatic brain injury or concussion, or other neurodevelopmental conditions that can impact functioning. So neuropsychological assessments are comprehensive. They involve multiple data points. So you're going to get a detailed interview with parents and caregivers. Again, the standardized testing in all of the areas that I described. And that testing is typically done in a controlled setting. We're going to review medical records, educational records. We're going to get a detailed developmental history and family history, which will inform the decisions that we're making in terms of clinical impressions. And we're also going to get input from teachers, from therapists, or other providers, in addition to input from parents and caregivers. And the goal is to create a detailed profile of a child's strengths and their weaknesses and provide actionable recommendations for interventions, not only at school, but also at home. So if you can imagine a child who's struggling with reading, a school evaluation might identify that this child is having more difficulty with reading than their peers and make recommendations such as extra time on tests or pull out for additional support for reading. But a neuropsychological assessment might uncover similar things about difficulties with reading, but also identify weaknesses in working memory or processing speed that impact not only reading, but other areas of learning as well. This insight allows for more targeted interventions and specific therapies to address all the areas where a child might need support. So that's a lot of information. Hopefully that is helpful in kind of understanding the difference between a neuropsych assessment and a school-based evaluation. But who gets referred for a neuropsychological assessment? It depends. It really depends on who's making the referral, who thinks it's important. I think it's important for me to say that not every child with school or behavioral challenges needs a neuropsychological assessment. It's not necessary to answer some of the questions that parents or educators have. So who needs a neuropsychological assessment? A child might need a neuropsychological evaluation if they have a neurodevelopmental diagnosis, but they require a more comprehensive evaluation because there's more going on that has not been explained by a psychoeducational evaluation. If a child has a history of brain injuries such as concussion or brain-based infection, long COVID, then a neuropsychological assessment would be helpful. Anyone who has medical conditions that put them at risk for cognitive challenges, for example, individual's children with genetic disorders, a neuropsychological assessment might be helpful there as well. Anyone with exposure to toxins such as lead or prenatal alcohol exposure, a neuropsychological assessment would be warranted there as well. Again, neuropsychological assessments can be very helpful for individuals who don't know why a child is struggling. And it could be a number of different things. Or they've undergone previous assessments where interventions have failed to address a child's needs and something is missing. Physicians may also recommend a neuropsychological assessment to establish a diagnosis. Maybe they want to see whether or not a child meets criteria for a diagnosis of ADHD, for autism, for a specific learning disorder like dyslexia, dysgraphia, dyscalculia. And a neuropsychological assessment can also be helpful when you're tracking changes in cognitive skills over time, especially before or after medical treatments or specific interventions. And so the results of a neuropsychological assessment offer more than just answers. They help parents understand a child's strengths and why a child has been struggling in whatever areas parents, educators, or other professionals have been concerned. What a neuropsychological assessment allows us to do is to put a plan in place to address weaknesses, but also utilize a child's strengths to help them thrive. So again, if we think about the key differences between these types of assessments and even how they complement each other, it really helps parents decide on what type of evaluation would be appropriate for their child. So again, some of the key differences are that school evaluations assess academic impact and eligibility for services in a school setting. Neuropsychological assessments explore broader brain behavior relationships. School evaluations tend to be narrower in focus. may focus on reading, writing, and math, and maybe some other areas, social emotional areas or processing areas like attention that can be impacted or can be impacting a child in a school setting, while neuropsychological assessments are more comprehensive and cover a wider range of cognitive and social emotional areas. Again, school evaluations determine accommodations and services. Neuropsychological assessments provide deeper insights into why a child might be experiencing specific challenges. I think another important thing to keep in mind is that these evaluations are not in competition with each other. At least they don't have to be. They can complement each other. Many families pursue a school-based evaluation first. And if a child meets criteria for accommodations and special education services, and those services are helpful and help a child access the curriculum and succeed academically, then that is sufficient. Some families pursue a neuropsychological assessment after a school-based evaluation to dig a little deeper because there are other things that they're concerned about and they want to get some additional guidance for ways that they can support their child at home. Again, the findings from both can be used to create, a plan that helps a child academically, socially, emotionally. And when you're thinking about a broader scope of assessment, that can provide other areas of support that go beyond the school setting. Some parents and even educators ask about a psychoeducational assessment, and that can also be done in a private setting. It's more like a school-focused evaluation, but can be comprehensive as well. It aims to understand a child's learning profile, academic abilities, identify any learning disabilities. It can involve a diagnosis. And even though the focus here is on educational performance, it can also provide information about social emotional factors that impact functioning in the school setting, outside the school setting. It gives you information about how a child is doing compared to their peers. And again, with a psychoeducational evaluation, the result is you have information that helps parents and teachers better understand how a child learns best and what support is needed to help them thrive in a classroom setting and at home. Many psychoeducational assessments and neuropsych assessments involve the administration of the same tests, and both assessments aim to help identify struggles and create a plan that helps address areas of challenge. But a neuropsychological assessment looks at the child's brain and its impact on behavior and learning, whereas a psychoeducational assessment focuses on academic skills, learning profiles, and social emotional factors. It really boils down to what the needs are of the family, what the concerns are of family members, the student themselves, educators, and other people who may have made the referral, like a speech language pathologist who's been working with the child, or an educational therapist who's been working with the child. But both provide valuable insights, but from different perspectives. So as I wrap up, I hope this episode has provided some clarity on the difference between school-based evaluations and neuropsychological assessments. Remember that both are tools designed to support a child's growth and their success. And if you're unsure which type of evaluation is right for your child or have questions about the process, feel free to reach out. Through Child Nexus, we're happy to help you navigate the decisions and help you to do so with some confidence. And we have a number of practitioners in our community who do evaluations or who can provide consultations on the type of evaluation that your child might need. So feel free to reach out to one of the providers. You can go to the Child Nexus website, do a search for providers, and connect with someone who can help you. Again, we are here to help. And if you need guidance, please feel free to reach out. Thank you so much for tuning in again to the Diverse Thinking Different Learning podcast. Don't forget to subscribe, share this episode with someone who might find it helpful, and leave us a review. That really helps other people find us. Thanks again. Until next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.